Well, the whole concept of the one call is very, very exciting. Even a discharge planner at a hospital, in the same scenario, they don't know what that patient's home is like. They have no idea what they're sending this patient home to. They can call us if the patient only needs a home care aide. We again will do an assessment at no charge to the patient, send someone out, and just determine what the need is in the home for this person. When that person makes the assessment, and that's going to either be a registered nurse or a medical social worker, both of whom have years and years of experience, they may determine at that point that that patient needs more than a caregiver. Then they would come to us and ask us to step in too. In the meantime, we have the resources to make sure this patient is accommodated and taken care of, and to try to prevent the rehospitalizations, which is a huge, huge measure that Medicare is looking at. But if a patient goes back into the hospital within the period of time, a certain period of time, I believe it's 30 days, that hospital gets no more money. So they are very, very fiscally motivated to reduce those hospitalizations. This is a place where Salus we can meet that need. We can help these hospitals meet the goal of keeping that patient home, keeping them from being a revolving door to the emergency room. Another way is patients frequently go back into the hospital because they miss their doctor's appointments. Our caregivers can drive that patient to their first doctor's appointment. That is vital. That gives the doctor a picture of how they are recuperating at home. They miss that appointment, 2 weeks later they're back in the hospital. So we can make sure that doesn't happen. There are agencies that can be called, and you can ask the question, do you have a caregiver? Yes, we have a caregiver. And they send the caregiver, and that's it. There's no assessment of the patient. There's no assessment of the home, the environment. There's no assessment to see how do you get your meals. It might be that they want somebody 4 hours. What happens the other 16, 18? In a 24-hour day. Those are the things that Salus finds out. How is this patient managing if our care person isn't there?